At this year's ASCO 2018, we also saw some very exciting data regarding a targeted therapy combination in patients with HPV-negative disease. This was a phase 2 non-randomized study. However, the response rate and the efficacy appear to be quite promising and certainly something that has been taken forward. The combination involved two drugs, one called Palbociclib, the other called Cetuximab. Palbociclib is a CDK4/6 inhibitor, small molecule, while Cetuximab, that's been around for now more than 10 years in head and neck cancer, is of course a monoclonal antibody directed against EGFR. Preclinical data suggested that this combination that inhibits both the cell cycle and very important EGFR signaling in cells, in squamous cell carcinoma, the head and neck cell lines, and in animal models was going to be quite effective. Earlier, the same group, led by Dr. Doug Atkins, had done a phase 1 study using this combination to try and find the most tolerable dose to take forward to phase 2. And in that phase 1 study, the response rate appeared to be quite high, with even some complete responses. And now we were waiting for the phase 2 data to confirm whether the promising response rate in phase 1 actually held up in phase 2. And in fact, what we saw at this year's ASCO was it did. The response rate was 39%, much higher than one would expect with Cetuximab alone, much higher than one would expect with Palbociclib alone. So the suggestion that there's not only additive but perhaps even synergistic increase in activity with the combination, plus the progression-free survival of greater than 4 months and the overall survival of greater than 9 months in a patient population that was platinum-refractory with recurrent metastatic disease, I would say is very promising and certainly worth taking forward and confirming in phase 3. In fact, that phase 3 study has been done, it's been completed. This was a comparison of Palbociclib Cetuximab versus Cetuximab alone in HPV-negative platinum-refractory patients. Those data have to mature, but given the phase 2 data, I think there's a very good chance that the phase 3 trial will be positive and we will have an additional combination and opportunity to treat patients with this very active doublet of Palbociclib and Cetuximab.